Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Today we are going to educate with presentation about anemia. It will be presented by Nabila Jelita Putri, Laili Nur Aisha, and also me, Yustiana Srikandi Arum Sukma. In this topic, we will discuss about the definition of anemia, factor affecting, causes and effect, and how to prevent anemia. The first is definition of anemia. Anemia is a blood disorder or hematological disorder that occurs when the level of hemoglobin, or the main part of red blood cell that binds oxygen, is below normal. Based on research data, World Health Organization provisions regarding anemia are below 12 gram HDL for women and 40 gram HDL. One of Indonesia's health problem is anemia that has not been resolved, and is one of health problem that continues to be the government concern and even the world. According to World Health Organization, the world population suffering from anemia around 2.3 billion. The cause is iron deficiency anemia by 15%. The highest anemia cases were in Southeast Asia and Africa, around 85%, while Indonesia was about 22.7%. According to Primary Health Survey, Rikasdas 2018 data, the prevalence of anemia in teenage girls aged 15 until 24 years was 84.5%.
Next, the factor of anemia. First, parents' income factor. Families of young women with less income are at risk of developing anemia than families with more income. Parents' income will affect a person's ability to meet all needs, especially nutritious food rich in iron and various kinds. The second factor is mother's education factor. Mothers who have higher education will pay more attention to their children's diet because their mothers know the nutritional intake their children need. Mother's education has an association with the incidence of anemia in teenage girls. The mother's education with high school had mild anemia status, and the low category of mother's education had severe anemia. Hence, it is evident that mother education plays a vital role in combining various nutritious foods and child care. The third factor is the knowledge factor. Young women with less knowledge have a risk of developing anemia than teenagers with acceptable knowledge levels. The study result concluded the lack of knowledge about anemia, signs and symptoms, complications, and prevention could cause teenagers to consume food that contain not much iron so that the iron needed is not fulfilled. To overcome this, namely in the form of counseling to young women about anemia. The fourth factor is factors for consuming iron supplement intake. When menstruating, teenagers who habitually consume iron tablets can reduce anemia, even though their menstrual cycles are not regular. And vice versa, if you do not swallow iron tablets regularly, and irregular menstruation cycles can aggravate the anemia suffer. Adherence to consuming iron supplements during menstruation was essential, especially if the menstrual pattern is irregular and aggravates the anemia. Teenage girls need to take iron supplements because they need iron to substitute for blood loss during menstruation. The last factor is menstrual state factor. At the age of puberty, young women will experience bleeding every month called menstruation. Menstrual patterns experienced by teenagers are generally not regular. It allows teenagers to experience excessive bleeding during menstruation, and blood donors who are not balanced with good nutrition are at risk of developing anemia in teenagers. Teenage girls who have abnormal menstrual patterns are at risk of 3,743 times of experiencing anemia compared to young women with normal menstrual patterns.
So the next one is the causes of anemia. The leading cause of anemia is iron deficiency. Other causes include insufficient nutritional intake and iron breakfast, frequent consumption of tea at the same time at mealtimes, lack of knowledge about anemia, menstruation, iron supplement intake, socioeconomic level, and family education. Balsero in 2012 reported that 59% of anemic incidences are caused by iron deficiency and 41% are the combination of iron and B12 vitamin deficiency. Then, the effects of anemia is anemia in teenagers can cause a decrease in work productivity, concentration level in learning, and disrupt health. The impact of anemia in teenagers were decreased reproductive health, decreased learning rates, a height that has not been maximized, reduced motor development, and inhibited brain intelligence. Anemia in adolescents will significantly affect pregnancy, childbirth, and maternal risk due to postpartum bleeding, prematurity, and low birth weight. So the next one is the prevention of anemia. The government has taken various strategic actions. One of them deals with anemia in teenagers, namely supporting the 1000 HPK movement by providing iron supplement in iron and folic acid. Based on this case that in 2018, young women who received blood booster tablets at school were 80.9%, while those who did not were 19.1%. Teenagers also should cooperate by routinely taking the blood supplement tablets. So, after all of the explanation, it can be concluded that first, anemia is a disease related to red blood cells and occurs when blood cells decrease. Second, there is an association between parents' income, mother's education, knowledge, consumption of iron supplements, and menstrual condition with the incidence of anemia in teenage girls. Third, teenagers should aware for their health, especially about the problem of blood deficiency. Not only for teenagers who is already suffer anemia, but all teenagers should aware about anemia. So let's prevent anemia by eat healthy food and routinely taking the blood supplement tablet. So that's all. Hope it will be useful for all of us. Let's prevent anemia together. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.